Our society has a great challenge with this pandemic. We are in this together, but we need a plan. This video covers a proposal we think will help. We have gone through long lockdowns. We flattened the curve and bought some time. The pandemic still weighs heavy on us, though. When can our kids play together? When can they go back to school? When can we go back to work? For those of you that want to ignore the virus, just open everything back up to save your business or your job. Think of it this way. Most other people, your customers included, are going to protect themselves, their spouses, children, and elderly family members above all else. They won't come back until it's safe for them and their families. Social distancing is difficult and costly. Plus, it requires the government to put out lots of rules. Open restaurants, close bars, curb service only, close the parking at beaches. Politicians and bureaucrats controlling everything is not going to work for us. I mean, let's be honest. Even the people making all of these rules don't always follow them. Some don't even set a good example about easy, no-brainer solutions like wearing masks in public. This proposal is simple. We have short but solid 2-week quarantine periods, alternating with periods of relaxed quarantine where restaurants can open and kids can go to school and play with their friends. We maintain reasonable social distancing all the time and wear masks in public all the time. We keep doing these pandemic breaks, short but effective, 2 weeks at the beginning of each month until the number of COVID-19 cases fall low enough to allow cases to be tracked and prevented from spreading. Different states and localities require different levels of effort. New York City, with its crowded sidewalks and crowded subways, will require more effort than small towns in rural areas. That doesn't mean that we can let the virus run free anywhere. The idea of pandemic break is like a fire break. You don't clear cut a whole forest to stop a fire. A pandemic break is a short but intense quarantine. A quarantine which is short enough so that everyone can participate and really drive down the infection rate. If we allow R, or the infection rate, to rise above 1.0, then each new case of COVID-19 will create at least one new case in the community, overwhelming our contact tracing infrastructure and leading to exponential growth in cases and a huge spike in the death toll. If we work to keep infection rates below 1.0, we allow contact tracing effectiveness to increase, which is our best tool in decreasing both the confirmed case numbers and the death toll, which is currently rising by the day. Let's run some simulations using covid19-scenarios.org to try and figure out what this might look like. So let's use the United States as our example. We are currently facing an uphill battle in the fight against this pandemic, but we can still take back control by implementing the pandemic break strategy. The USA has a population of over 300 million with a confirmed case number of over 8 million COVID cases. So far, the US has lost over 220,000 Americans since the beginning of the year. If it gets bad enough, we will be looking at abrupt, long, damaging shutdowns on the economy and our regular lives yet again. So what can we do? Well, I already mentioned a great preventative strategy. Pandemic break is a prescription we can use to save thousands of lives. It's simple. A short, precise template for states or our country as a whole to use, ensuring that U.S. officials can balance the importance of the safety of their constituents with the preservation of their way of life. How would this look implemented? Let's look at what applying pandemic break to the U.S. and our current situation might look like using covid19-scenarios.org. We will run parameters to show what this would look like implemented and how it would decrease infection rates, therefore increasing effectiveness of contact tracing, reducing strain on our healthcare system, and reducing strain on resources like PPE or treatments for COVID-19. By January, our death toll will be over 300,000, and unfortunately, this seems unavoidable. Let's use our parameters to build a timeline and see what the U.S. would look like by December 2021, both with and without pandemic break. While the infection rate naturally fluctuates, it never goes under 1.0, causing a huge spike in the case number, resources used, and death toll. No proactive strategy allows the infection rate to spike to 2.75 by April. As already discussed, what this means is that each confirmed diagnosis of COVID-19 creates 2.75 more new cases in the community. As a result of the high infection rate, the death toll nearly doubles, increasing to over 600,000 by April. Continuing to use a reactive strategy, or a herd immunity strategy, means that we will accept over 1.5 million more American lives lost by December 2021. Looking back at our original timeline, if we implemented pandemic break by January 1st, we would begin the first pandemic break and see an immediate drop in the infection rate. By the end of the first pandemic break, the rate would drop to an average of about 0.46, meaning that each confirmed case would produce less than one secondary case of COVID-19 to be tested, treated, and traced in the community. Doing this until December 2021, at the beginning of each month, we can actually see the impact that pandemic break has on 1, the infection rate, and 2, the death toll in the U.S. In comparison to doing what we have been doing, pandemic break can save between 858,000 to 1.52 million American lives. Pandemic break is our way to take back control. And yes, break this pandemic. We can save hundreds of thousands of lives using this strategy. It's not easy, however, unspecified lockdown periods, being unable to visit sick loved ones, and loss of life are much harder. Hundreds of thousands of American lives at risk of being written off forever, we should not accept that. Take a stand and share the pandemic break strategy today. Call your local official and tell them that you deserve a better alternative.